Hello, everyone. It's a pleasure to be here with you today. I'm certainly being very well educated this afternoon. Very interesting presentations, very terrifying presentations and information, not the presentations, I should say, the information being provided. So it's really an honor to be here with you today. So I'm very happy to, and I just met both of these women, and very briefly, Dr. Cathy Holtmann, and I'm going to read a little bit. I know that a lot of you have this information. I want to give it the credence that it deserves. So professor and chair in the Sociology Department of UNB in Fredericton. She's the academic lead of the Religion and Violence and the Violence Against Immigrant and Visible Minority Women research teams at the Muriel McQueen Fergusson Centre. Her areas of research expertise include gender and religion, family violence, and immigrants. Welcome, Dr. Holtmann. And I'm very pleased as well to introduce Dr. Mayme Lefurgey, who is an adjunct professor in the Department of Sociology and a research fellow at the Muriel McQueen Fergusson Centre. Her research is at the intersection of gender, power, and violence and explores trauma-informed, community-driven, and embodied approaches to addressing violence, including wartime violence, structural and systematic violence, family violence, and gender-based violence. Mayme holds a Ph.D. in Women's Studies and Feminist Research from Western University. Very interested in your presentation, particularly given that New Brunswick is such a rural province in nature, and I'm sure we have lots to learn from you this afternoon. Welcome.
Well, thank you, Shannon, for that introduction, and thanks to Denis and all of the staff at the MMFC for inviting Mayme and I to present on our work. I'll tell you a little bit about the context for the data that we're going to speak about today. So the Canadian Domestic Homicide Prevention Initiative was developed in partnership with the Centre for Research and Education on Violence Against Women and Children, which at the time of the start of the initiative was being led by Peter Jaffe and currently is being led by Katrina Scott at Western University, in partnership with the Center of Study of Social and Legal Responses to Violence, which is led by Dr. Myrna Dawson at the University of Guelph. So this project has been running now for about 10 years, and it was funded with grants from SSHRC and from the Canadian Women's Foundation. So I'm a co-investigator on the national project. I've been with the project since about 2016. And Mayme and I started working with data from the project when Mayme was the recipient of a Purdy Crawford postdoctoral fellowship here at UNB, and she focused her work on accessibility of survivors of intimate partner violence to IPV services in northern New Brunswick. So we're going to be talking about, or Mayme's going to be talking about our analysis of phase 3 data, which was part of the project. But I just want to say that the project included 3 phases of data collection, and which is why it's been going on for so long. The first phase was primarily quantitative data on domestic homicides in Canada. And I know that there's been an initiative to try to coordinate review of domestic homicide data in Atlantic Canada. And certainly the project, I think, was an important catalyst in that work. The second phase of the project was online surveys and then in-person interviews with intimate partner violence service providers, which were referred to as key informants throughout the country. And then the third phase was interviews with survivors of severe, potentially lethal intimate partner violence and the friends and families of victims of domestic homicide. And so that when you see proxy, those would be the friends and family of people who were murdered. The project, as I said, was across the country and involved multiple universities. And so the research ethics submissions started at the University of Western Ontario and the University of Guelph, but literally went to research ethics boards, I think, in about 30 universities across the country. It's probably one of the most detailed ethics processes I've ever been part of. And I have to give a lot of credit to the research assistant here at the Muriel McQueen Fergusson Centre, was Dr. Mary Aspinall. At the time, she was pre-doctor, but she was a research assistant. And so she was trained along with other graduate research students involved in the project at the University of Western Ontario in trauma and violence-informed research methods. And then Mary and I conducted the interviews. I did pre-screening interviews with potential research participants, and then Mary and another graduate student at St. Mary's University conducted the interviews that took place in Atlantic Canada. They had survivors, in order to participate in the research, had to be one of the following, what we considered to be vulnerable populations. So Indigenous, rural, remote, or northern, immigrants and refugees, and children exposed to or killed in the context of domestic violence. And there was some intersection with some of those populations for some of the survivors. Proxies, as I said, were friends or family who could speak about the case involving domestic homicide. All research participants were 18 years of age or older. They had to be currently safe, and that was a big part of the pre-screening interviews, just to determine what their level of safety was at the time, and also if criminal proceedings were completed. We didn't want anyone speaking with us who were involved in active court cases, because things that would make it extremely difficult for us to use their data, because it was part of a court case. And then their experience of either being close to someone who was murdered or potentially or exposed to potentially lethal violence was between 2006 and 2016. In total, for this phase of data collection, there were 127 interviews conducted throughout Canada between 2019 and 2022. And those dates obviously coincide with the pandemic. And so many of the interviews had to be conducted virtually. Mayme and I chose to analyze interviews from Anglophone, so English-speaking, non-Indigenous survivors living in rural and remote regions of Canada.
So this afternoon, I'm going to briefly be speaking about a subset of the rural data in the broader data set that Cathy just spoke of. So our analysis looked specifically about survivor resilience and strategies for safety in the context of domestic and intimate partner violence, or DIPV, in rural Canada. And we thought that this focus on rural survivors is really necessary given the higher severity of violence in rural Canada, and also the increased barriers to accessing services and supports, both formal and informal, in rural communities. So we analyzed our data against the backdrop of Michael Ungar's social ecological model of resilience. And we've really focused on the development of resilience among survivors as a dynamic process of adapting, resisting, and transforming resources and relationships in rural communities. So this framework allowed us to really look at the unique interplay of individual agency and social support when navigating situations of DIPV, by considering the full spectrum of psychological, social, and material resources at individual, relational, and community levels. So we found that survivors of DIPV in rural contexts use their agency in unique ways by harnessing informal strategies and relationships alongside the available formal supports. So Cathy, I think, mostly has covered this, but our sample is women identifying individuals. The average age was 40. Most of the survivors in our sample had children, and the data that we looked at specifically was the non-Indigenous and Anglophone transcripts of the broader rural subset of the study. So our analysis found that DIPV takes place in unique and complex ways in rural Canada. And one of the key elements discussed by the survivors in our sample was the degree of isolation, both geographically and socially, that they experience when navigating seeking support for DIPV. So the isolation described by the survivors in our sample was often a central part of the abuse and control that they experienced. And this was further complicated by other intersecting life conditions like a lack of financial independence, barriers to accessing technology or transportation. So many of the survivors in our sample lived on large properties or farms with firearms or other weapons on site, which also really amplified the severity and risk of death or severe violence in the sample that we looked at. So some survivors in our sample had few neighbors, and a lot of them lived in disconnection from a sense of community, or they lived far from their own family or friends. And were integrated into the abuser's community. So the participants in our particular sample described an array of severe experiences of DIPV. Some that were prevalent were coercive control, sexual assault, cases of sex trafficking, situations of being held captive, threats with guns or other weapons. So participants also described attempts by the perpetrator to burn their house down or kill or harm their pets or farm animals. In terms of injuries, some survivors experienced broken bones, others experienced strangulation or suffocation. Many of the perpetrators in our sample committed violence while intoxicated by drugs or alcohol. Survivors reported a lack of local DIPV services and difficulty accessing a shelter in rural communities. Many described long wait times for emergency services, both when going to a service and also when calling a service like police to their home. So we analyzed our data with the social ecological model, which looks at 3 levels. So I'm going to go through individual level strategies used by the survivors in our samples, and then talk more about the relational level strategies, and then end with a discussion about what types of community-based like formal supports were accessed. So survivors described an array of adaptive behavioral strategies and intentional actions taken both to diffuse violence in acute scenarios and also to prevent the onset of violence. Survivors frequently use negotiation or distraction strategies. For example, in the quote on the screen, the survivor distracted her husband with bathing the children while she collected what she needed for them to soon flee. So she says, I'm like, oh, could you bathe the kids? Could you just do that for me? Just so I can get things ready. And he agreed to it. And I literally took the diaper bag and I put as many diapers in and as many clothes of theirs as I could. I literally had the clothes on my back and maybe an extra shirt, like nothing more. I grabbed their passports, I had some jewelry that belonged to my mom who had just passed, and I wanted to grab those things. I put them in the truck and that's all I had. And that was shared from a survivor in Atlantic Canada. So on the relational level, rural survivors of DIPV spoke about how family, friends, and other people in their relational and social networks became part of their informal and very meaningful support system. At times, these folks connected survivors with formal services and communities or accompanied them to appointments. And we have another example here. So this survivor was talking about having a code word with her brother to alert him if her ex-husband showed up on the property. So she says, no one knew about the violence. I didn't start talking about it until a week before I left. I finally told my brother, so once I started talking about it, it became real, and I got really anxious and really scared. And within a week, I had moved out. I had taken the kids and came up with a plan, and I came up with a safety plan along the way. You know, if I ever texted my brother my mom's name, that was our code word. That he was to call the police right away and send them out. That is also a survivor in Atlantic Canada. So on the relational level, overall survivors seem to have mixed feelings about telling their families what they were going through. They often appreciated and needed the emotional and pragmatic support, but there was a lot of fear about not wanting to worry their family or put their family members at an increased danger as well. More frequently in the interviews that we read, survivors talked about support from their friends. And this support was often pragmatic, such as providing them a place to stay, or a lot of examples of friends being logistically involved with safety planning. So one survivor had set up her cell phone to send an SOS ping during a violent incident with a pin drop on a map, and this would alert her friend that she was in danger and to call emergency services. On a community level now, the survivors in our sample often chose the individualized and relational strategies for safety that I've just described, largely due to the lack of services available in rural Canada. But it's really important to note that even in situations when services did exist, survivors in our sample were sometimes reluctant to access them due to the perception that confidentiality wouldn't be upheld and the fear that it could possibly put them or some of their loved ones in danger if they sought formal services. So survivors frequently express concern about knowing service providers personally or fearing that the whole town would know what was going on in their personal lives if they sought help. So because of this, survivors frequently reported feelings of shame and isolation when navigating help seeking on a community level in rural communities. So one survivor reported that of the 220 residents in her community, 75 of them were the direct relatives of her abuser, and she really felt like she had no one safe to turn to. And in another example that I have up on the screen, we see a woman who went to file court papers related to her abuse and realized that it was her abuser's friend working at the courthouse. So she shares, and when I filed my papers, of course, it's my ex's friend that takes, and she's working at the courthouse, and then she phones him right away and says, guess who was just here? And then this court employee would also during the trial sit with him on his breaks and console him and say, don't worry, you'll be partying soon enough, loudly so I could hear it, right? So it just became that, so it became everyone was related. It felt like, and I felt very alone in that small town. I didn't grow up there and he did. And that's from a survivor in central Canada. So most notably, the survivors in our sample sought the help of DIPV shelters. And we felt it was important to note that when they were accessed, the response was overwhelmingly positive. For a lot of survivors, it was the first time that they felt really validated and supported in their experience. So we felt that it was really important to note the really critical role that shelters play, even for folks in rural communities who sometimes have a hard time accessing. And that also wasn't the case for other service providers such as police. So in terms of our overall implications, geographic isolation and limited services really force rural survivors to rely more heavily on informal networks, family, friends, coworkers. The tight-knit community ties in rural communities can foster resilience and offer a built-in support network, but it can also increase risk. And a key finding from our work is that informal support networks really can and do play a crucial role in building survivor resilience, regardless of access to formal services or not. So we think that this is something really important for the sector to focus on, and is something we'll expand on in our recommendations.
Yeah, so we do in our recommendations suggest that there needs to be increased education and awareness of the critical role of informal supports in rural communities. We know that there's lots of advocacy going on for more access to formal services, but really these untapped informal networks are already being used. And so, for example, in my work with the Religion and Violence team, we've really sought to educate and train members of faith-based communities, because often, that's an integral part of rural community life. And we saw evidence in our data of how those communities, unfortunately, were not helpful because of lack of confidentiality and lack of understanding of the dynamics of domestic violence. And so in order to use those informal networks or harness them, because they're already being used, but harness them so that they can better protect the safety of individuals, they need training and they need opportunities to learn more about the importance of their role, because they're already being used and they could be more effective. Same with their relationship between the informal networks and the formal networks. We saw often that if people did choose to use formal networks, it was a friend or someone who encouraged them. There was one case where a woman said, okay, I'll do this for you, but then you have to promise me that you're going to talk to the domestic violence outreach worker. Okay, there was this kind of, and then the woman said, I promised my friend because, she helped out with my kids, so I'm going to do that. And so this sort of leveraging of the informal support to connect to formal supports. But of course, that can only happen if people are aware of the formal supports in their communities, right? And there's a lack of knowledge about that. So there's, and then I would say probably on the service provider side, there's a lack of knowledge about these informal support networks, right? And so there's education to happen on both sides. We really think that this, harnessing of informal supports would help in terms of safety planning, especially. Okay, so they're being utilized in many ways, in a variety of ways, in terms of safety planning. But even I think we could see even more in terms of that. And this is sort of tied in also with formal supports, that exploring options to connect rural survivors to either anonymous or specialized services using technology. There were numerous examples of survivors using mobile phones and their computers in terms of their strategies for seeking safety. And recent studies conducted by research associated with the MMFC, Post-COVID Project, and the Mayme Project also show the usefulness of digital technologies for service providers in their work of supporting survivors. So we recommend that rural communities should further explore options for survivors to domestic violence services, sort of digitally or remotely, that are safe and confidential. And so, just off the top of our heads, thinking about sort of public spaces like public libraries, schools, and health centers in rural community, where there is good connectivity and where the safety measures could be put in place so that those, that contact with service providers is not detected by either the perpetrator or members of the perpetrator's social network.